Welcome everyone, Dr. Mandell here. I got your back when it comes to gastric reflux, heartburn, LPR, laryngopharyngeal reflux, that silent reflux, that burning you're getting into your chest, into your throat, as well as in your nasal pharynx region. You may be getting dripping, but there are many symptoms that acid will cause in your body. The LES, the lower esophageal sphincter, is a sphincter that closes when food from your esophagus gets into the stomach. Unfortunately, there are several things that can cause that sphincter to relax, allowing the food to come upwards back into the esophagus, making its way all the way into the chest, into the throat, and into the nasal pharynx region. When we look at GERD or silent reflux, the treatment and our strategies are going to be the same. It doesn't matter about the symptoms. We need to knock this thing out and do it the right way. So when that acid makes its way up into the esophagus, the lining of those cells become extremely inflamed and irritated. Common symptoms is heartburn, hoarseness, difficulty swallowing, excessive mucus in the throat, chronic cough, chronic throat clearing, as well as a sensation of a lump in your throat. But it is fairly common to affect your throat because all you need is a little bit of acid with those cells that are different from the esophagus, and your throat can give you lots of problems. The first thing you need to do is to decrease the total fat intake. The high fat meals, the fried foods will decrease that lower esophageal pressure, and it will delay the stomach emptying, therefore increasing the risk of that reflux. So if you are on that keto diet having those excessive fats, you need to be careful because that acid can cause lots of problems. You must avoid those large meals. Those large meals increase the likelihood of increased gastric pressure and reflux. You need to avoid the chocolate, because chocolate contains methylxanthine, which has been shown to reduce that lower esophageal sphincter pressure by causing it to relax the smooth muscle. Avoid coffee if all possible. Coffee with or without caffeine will promote reflux. And avoid those known irritants like alcohol, peppermint, spearmint, carbonated beverages, citrus juices, and tomato products all may aggravate reflux disease. To manage your reflux problem, you must make lifestyle modifications. Eat several small meals throughout the day. Exercise at least 3 times a week. Make sure you're wearing loose-fitted clothes, especially in the abdominal area. And one of the most important things that helped me is to wait at least 3 hours after your last meal before you lie down. If you are overweight, you will see dramatic changes with your reflux. When you start losing the pounds, your reflux will start to dissipate. When your reflux is bad, make sure you're sleeping on an incline. That will prevent that acid to make its way up into the esophagus. You must clean up your diet. If you're eating a lot of refined sugars, that will cause more acid. Make sure you're eating lots of fruits and vegetables and you're drinking lots of water. So follow these steps and you will start to see amazing changes as your reflux starts to dissipate. Please share this with your friends and family. Leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.